on Tuesday, the Taoiseach disgracefully tried to shift the blame for his and your failure, the government's failure to tackle the perpetual trolley crisis in our hospitals by attacking our hard-working and diligent nurses and doctors, and not content with insulting tens of thousands of frontline workers once. Yesterday, the Taoiseach doubled down on his remarks. Minister Simon Harris, a person who should know better, has now shamefully weighed in behind him, and it's an absolute disgrace. Taoiseach, nurses and doctors' leave is not the cause of our problem in our health service. The trolley crisis and overcrowding is due to capacity issues and the continuing and worsening recruitment and retention crisis. It is up to the government, and the government alone, to address these escalating issues, not ordinary nurses or doctors who serve the public day in and day out. It is your problem, Taoiseach. It is your government's problem. And after almost 8 years in government, you have completely failed to address the trolley crisis. When he was Minister for Health, the Taoiseach missed targets, saw record numbers of patients on trolley, oversaw botched recruitment schemes, saw the numbers of waiting lists soared, and stumbled from one disaster to another. And for him to now attack frontline public health service workers for his and your government's failure is gutter politics, Taoiseach. Blaming nurses and doctors is not going to solve a single issue in the health service, and indeed, it most certainly will not help with the recruitment and retention crisis that we face. Some weeks back, the Taoiseach launched another attack on health workers, saying that despite an increase in staff, there had been no corresponding increase in productivity in the health service. That is a blatant lie. Like his attack on them this week, it is a blatant falsehood. The Department of Health have stated on the record that A&E attendances are up, surgical day cases work is up in excess of 70% over 10 years, outpatient assessments have reached 3.3 million annually, and the annual inpatient discharges are up 7% over 10 years. And all of that work, Taoiseach, all of that work is done by hard-working nurses and doctors that the Minister and the Taoiseach decided to attack. To tackle our overcrowding, what is needed is a strategic plan. Do we have one? Of course we don't. Because the Taoiseach and the Minister for Health would rather attack nurses than put their shoulder to the wheel and tackle the root causes of this problem. That is the easy way out. It is the cop-out, Taoiseach. And contrast that with what's happening across the water with the NHS. They have published their winter plan in September. So what I want, Taoiseach, from you is to answer these questions. When will we see the plan to tackle overcrowding, which will increase capacity in the health service, one that will address recruitment and retention crisis and deliver proper step-down facilities and home care support for our vulnerable? Because that is what's needed. Not simple attacks on frontline workers, not stupid and insulting remarks. And can I ask you, Taoiseach, to take this opportunity here this afternoon to apologise to the nurses and to the doctors for the Taoiseach's hurtful and ill-informed comments that he made yesterday and the day before.
Thank you, Deputy Taoiseach.
Let me try and address this issue honestly rather than grandstanding as the Deputy has just done. The issue of preparing for winter requires honest conversations. And this isn't just the government's problem, it's everybody's problem. The HSC, hospitals themselves, the Department of Health, government in terms of policy and financing and budgets, we all need to work together to ensure that the patient care that we expect and that we need to deliver for people in hospitals, particularly through a pressurised winter period, can be as good as it possibly can be. And the Taoiseach, in his usual style, was honest and upfront about one of the problems in relation to the Christmas period, where there is a challenge around rostering and ensuring that senior team leaders in particular are there in person through that time of year, which is obviously a family time for many people as well. But we have got to prioritise patient care even at Christmas time. And that was the point that the Taoiseach was making, and in my view made it in a fair and direct way. And what he is saying is that we need to work together to ensure, and Minister Harris has reinforced this, that we have the rostering procedures in place to ensure that senior people in particular and their teams are there at times when we are most pressurised in our hospitals, so that patient care is the #1 priority, as opposed to anything else during rostering at this difficult time of year. That was the point he was making. And you're trying to spin that into an attack on consultants and nurses, which it never was and isn't. The issue in relation to capacity is the real issue here. Everybody accepts that, but it can't be solved overnight. This year, increasing capacity is a priority for government. Over the past 12 months, an additional 240 beds have been opened, and a further 79 additional beds are planned for Q4 2018 and early 2019. This includes an additional 30-bed ward in Our Lady of Lourdes Hospital in Drogheda, a 40-bed modular ward in South Tipperary General Hospital, and 4 high-dependency beds in the Mater and Cork University Hospital, respectively. In addition, the new emergency department planned for Our Lady of Lourdes Drogheda is due to open in early 2019. So, Deputy, we accept that there is a need for investment and expansion and to increase capacity. And also there is a recruitment and retention issue that we are also looking to try and address. But the idea that we can pretend that rostering is not an issue and that in the next few weeks and months that we shouldn't be preparing for that and having an honest conversation about it with people who are well able to engage in that honest conversation, in my view, is political correctness gone mad.
Before proceeding to business, I wish on my own behalf and on behalf of the members of the Dáil to offer a Céad Míle Fáilte, a most sincere welcome to His Excellency Maroš Šefčovič, Vice President of the European Commission. The Commissioner is joined by officials travelling from Brussels and our friend Gerard Kiley, Head of the European Commission Office here in Dublin. You're most welcome. Deputy Doherty.
Let's call a spade a spade. Because doctors and nurses know what the Taoiseach was at. They know he was attacking them. They know they were trying to shift the blame for the lack of capacity and the lack of recruitment and retention policies that your government has failed to deal with onto the frontline workers. And it hasn't been lost on them same nurses and doctors that when the Taoiseach was Minister for Health, during the Christmas period of 2014 and New Year of 2015, where was the Taoiseach? He was holidaying in Miami at a time when the trolley crisis in this state peaked to record levels. So he has some cheek in him. And listen to doctors and listen to nurses. Listen to the media reports that were in Morning Ireland this morning. There will be more consultants in the hospital in Cork in January than there will be at any other time during the year because of leave. This is about a blatant deflection on your failure of government to deal with this issue. You talk about your prioritising capacities. I'm sick to the teeth telling you that there is a 20-bed ward that the management of the hospital in Letterkenny want opened. They made an application a year and a half ago. The HSE want it opened. The department will not open it. And this is no longer a winter problem. It is an all-year-round problem. 700 patients and trolleys in March, 600 patients and trolleys this month, 525 today. This is an all-year-round crisis. You need to get to grips with it, and you should do the decent thing, Minister. You should apologise to those nurses and doctors for the insulting and the hurtful comments that the Taoiseach, that the Minister for Health, and that you're doubling down on here today.
Deputy, people in our health service work extraordinarily hard under, in many cases, very difficult circumstances. We know that in government. The Taoiseach is a doctor himself and has a very clear understanding how hospitals work. And so what we are at here is about short-term planning for what we know will be a very pressurised winter period and addressing all issues on that, from capacity to try to de-escalate challenges in advance of the Christmas period within hospitals, to increase investment in relation to social care, to get people out of hospital care where possible, to ensure that they're looked after properly in different settings, to create space within hospitals. And we are also trying to have an honest conversation in relation to rostering, to make sure that the clinical leadership and health team leadership is in place over the most pressurised time of year. Nobody is arguing, Deputy, that it's not a year-round challenge to address capacity issues. And that is why in the budget we've seen massive increases for the health budgets, much of that going into capacity, going into both staffing needs and capital investment. But there's a short-term challenge that we need to plan for. The answer to your question, by the way, is the winter plan will be finalised shortly and will be available for people to be able to see.
Thank you, Taoiseach.
But the issues that we need to address do require an honest and practical conversation, and that is what the Taoiseach has contributed to this week.
Deputy Brendan Howland, please.